are here for Human Services Committee, March 25th, 2026. Our only item of business today is the nonpartisan staff's follow along of the A2 delete all amendment to Senate File 476. So this is our work that we have been putting together. This is going to be our Omnibus Human Services policy bill. So on Friday, we'll take public testimony and mark up that omnibus. And so we'd like written testimony in lieu of person in person. You're going to be 2 minutes each. So just check our page for those listings. So before we go to Mr. Monahan, Senator Abler.
Well, thank you, Mr. Chair. I understand work and I understand play. So it'd be fun if at the end of the work phase, we could play for about 2 minutes and talk about 4222. That's all. Thank you. That will be not even work. It's going to be so amazing. It'll be like just a respite moment. Thank you, Mr. Chair.
That was good what we did on the floor today, Senator Abler, and thank you for that. That gives us that ability to do our other work that we're doing. So and with that, I am then going to head over to transportation. So Mr. Monahan, if you could take us through the language of the omnibus, and then if there's, he'll pause at the end of each article if you have any questions. And with that, please proceed, Mr. Monahan.
Mr. Chair, members, I'm going to be walking through the bill using the bill index that should be in front of you. Should be copies for the public as well. Just a caveat here that this index is literally hot off the presses. It's probably still warm. I haven't even read it yet myself, so I'm going to stumble through this and apologize in advance. If anybody in the public notices any mistakes in the index, I would like you to let me know. The choices made were not mine, but just if the index itself is wrong. So Article 1 is a initiative by the chair to strengthen continuity of care for individuals receiving certain residential waiver services following the commissioner withholding payments to a residential service provider that might affect a resident's receipt of services. This was heard informationally on Monday, March 16th. It's been modified in a few ways since then, and I'll spend a bit more time on this article since it wasn't officially heard earlier in session. So sections 1 and 2 make changes to the HCBS services standards by modifying the circumstances under which a provider may suspend or terminate services for non-payment by conforming the standards to those standards that apply to assisted living facilities. That standard allows 60 days of non-payment from a public source before service suspensions or terminations are permitted. So that same standard is imported into the HCBS service standards. It also adds integrated community supports to a list of other residential service settings for which the provider must inform the commissioner of service suspensions or terminations when they occur.
Mr. Chair.
Senator Abler.
Is it good to ask questions along the way, do you think?
I was told we were going to ask at the conclusion of each article. Is that okay?
Okay,
with you?
it's fine.
Okay, thank you.
That'd be sort of along the way. Yeah, thank you.
Yes, thank you. Mr. Monahan, you may continue.
Thank you, Mr. Chair. Section 3 establishes a new HCBS service standard for ICS service providers by requiring the provider to account for each client's payments to the provider for rent and housing related expenses, essentially creating a bank account or some other mechanism to segregate the residents' funds that are used to pay rent from other funds the provider uses to run their operation. Section 4 establishes within existing resources at the department a continuity of care team at the Department of Human Services to pre-plan, coordinate, and oversee the continuity of care of all clients of a residential waiver service provider who is subject to a payment withhold initiated by the commissioner, and provides for direct intervention by the continuity of care team at a lead agency's expense if the lead agency is unable to adequately establish continuity of care. Section 5 makes 2 changes to the statute governing payment withholds. First, it clarifies that the commissioner has the authority to stop a payment withhold under federally defined good cause exemptions. And 2, requires the commissioner to coordinate with the department's continuity of care team before implementing a payment withhold so that the continuity of care team has sufficient time to pre-plan for any disruption in residential waiver services that may result from the payment withhold. And Sections 6 and 7 clarify that an individual who was previously receiving integrated community services may continue to live in an ICS setting and receive other services, including individualized home supports, in the same ICS setting, provided the services are not being provided by the former ICS service provider. And that's the conclusion of Article 1.
Thank you, Mr. Monahan. Senator Abler.
Well, thanks. I think I like this section. I haven't seen it either, but I like the way it's going, and it's, you know, actually when something new comes along, we have to find a way to work through it. So, Mr. Monahan, you've talked about just the question about if you, so they're adding, you have to keep giving services for 60 days if you've lost your money. And so can you, you're the messenger, I understand, but can you, how can a person provide 60 days of services when they don't have money? Is that an illogical thing that you wonder about too, or is there a way to remedy that? I just, well, in October, a person lost services and they had no way to pay for the PCAs didn't want to go to work for nothing, and so the person wound up dying. And the commissioner in the paper was quoted as saying, well, they should have continued to give care. So I guess my concern is, are we creating a duty with this new language, or is it just kind of restating what they would expect anyway?
Mr. Monahan.
Mr. Chair, Senator Abler, it is creating a duty to continue to provide services for 60 days.
Okay. Thank you,
Senator Abler.
Mr. Chair, just to you and to the, you know, I just think again, the messenger, and I'll talk to Senator Hoffman, I don't think we want to create a duty where there's the inability to do what they're supposed to do. I think that's the purpose. I like the idea about this continuity of care team thing. And I know the department told us that they were, you know, had this thing and they're aware of stuff. We found out they only know about 75 people or so out of the thousands that aren't getting something. So, Mr. Chair and others, as we move this, I think we just want to be sure that we handle this eventuality. It's an eventuality that I don't think that the department foresaw, at least to the extent they would be doing. And maybe when they ever come to talk to us, which isn't very often, it seems like, they can explain how they think this should happen. So thank you, Mr. I'm done.
Thank you, Senator Abler. Any other member questions before we go to Article 2? Awesome. Mr. Monahan.
Mr. Chair, members, Article 2 is the Aging and Disability Services Policy article. The majority of this language is from Senate File 4858, which was heard informationally just on Monday, maybe. I've tried to indicate which groups of sections are policy proposals from the department itself. I've indicated that by putting in bold their description of their initiative. So you'll see that sections 1 to 3 and 41 are related to the foster care moratorium language cleanup. I should pause here and say that sections 1 through 3 were the results of perhaps freelancing on my part to clean up the existing language. So it looks like 3 sections of all new language. In actual fact, none of it is new, and the effect of it is exactly what you would have seen in section 1 of Senate File 4858. Next group of sections, 4 to 6, are from Senator Hoffman, Senate File 4279. This is related to the location requirements for licensed residential settings, or the proximity limitation bill that was heard the other day. This is just half of those sections related to DHS licensed settings. The other half of the language will appear in a later article. The next group of sections, beginning with section 7, are the sections related to the repeal of the housing stabilization services and the direction to the commissioner to develop a substitute housing-related MA benefit. Next group of sections, beginning with section 10, are from Senator Utke's Senate File 3898. It's sort of 3 relatively unrelated provisions related to providing HCBS services. The first grants a licensed provider of HCBS services a 90-day grace period for its staff to complete certain annual training. Section 13 limits the requirement that a provider maintain copies of progress review reports, progress notes, and daily log notes to providers of home and community-based intensive services. Under current law, they have to keep those records for all HCBS services, so this limits it to just intensive services. And also, Section 38 limits lead agency's authority to request documentation not required under the statute when considering a renewal of the disability rate exception. The next sections, beginning with section 11, are a DHS initiative to clean up language related to HCBS and positive supports. Section 14 is Senator May Quaid's Senate File 4508 that modifies the senior nutrition programs. Section 15 is from House File 3379 as amended. This requires the commissioner to publish on the department's website the text of all public comments on a proposed Medicaid state plan amendment or waiver plan. Section 17 is also from House File 3379 as amended. This clarifies the commissioner's authority to make changes to the medical assistance program without legislative authority. The next group of sections, beginning with section 18, are from the DHS policy bill. All these sections are related to the EIDBI program integrity changes proposed by the department. The next large group of sections, beginning with section 20, are a modified version of Senator Muhammad's Senate File 3928. This is her proposal for a pass-through for shared CFSS services, a pass-through to the support worker. Section 25 is a DHS initiative related to tribes certifying their own min-choice assessors. Section 26 is a DHS initiative related to repealing some obsolete language related to min-choices because that data has been incorporated into another data reporting website of some sort, dashboard, I think they call it. The next group of sections, beginning with section 27, are related to DHS's proposal for tribal VA and vulnerable adult and developmental disability targeted case management. Section 35 is a DHS proposal related to informed choice for members of tribal nations who are receiving disability services, I believe. Section 36 is a modified version of Senator Utke's 3659 that eliminates the daily limit of 6 hours per day for individualized home supports with training and replaces it with a limit, with a monthly limit, and also for both individualized home supports with training and individualized home supports with family training. It eliminates the current law prohibition on billing for no more than 3 consecutive hours. The next group of sections, beginning with section 37, is a DHS initiative to strengthen the cost reporting oversight under DWRS, the Community First Services and Supports Program, and the Elderly Waiver and Alternative Care Programs. The next grouping of sections are related to the DHS initiative for federal compliance under the Vulnerable Adult Act. This primarily has to do with the county's responsibilities with respect to adult protective services. In the middle of the Vulnerable Adult Act language, there's a single section, section 52, that's unrelated to those other proposals. Section 52 comes from Senate File 4279. This is a provision that was being carried in the proximity limitation language for residential settings. It expands the requirements related to notice given to reporters of maltreatment of vulnerable adults to keep them informed of the progress of the case. Section 70 modifies the due date of the Pediatric Hospital to Home Transition Pilot Program report. And finally, the repealer is repealing a number of things, mostly the Housing Stabilization Services statutes. It repeals historic and obsolete ICFDD rate increases. I'll just mention this is unrelated to the other issue about the inflation adjustment related to ICFDD. And it repeals a section that's recodified in the article. And that's the conclusion of Article 2.
Thank you, Mr. Monahan. Are there any questions? Senator Abler.
Well, thank you. Oh, my speaker is still on. Mr. Monahan, do you know that municipality language that is scattered throughout here? Is that the bill the way it left? But there's some talk of a compromise. Is this the original language?
Mr. Monahan.
Mr. Chair, Senator Abler, the language that is in the current amendment is the language with some, should be the same as Wednesday.
Senator Abler.
Just making sure, I thought there was some compromise going on, but
Thank you. Senator
I
Gruenhagen.
appreciate that, thanks.
Thank you. Thank you. Senator Gruenhagen.
Yeah, on line 6727, on page 66, it looks like we're making counties responsible for all adult protective service investigations, assessments, initial contact, legal interventions, and determinations. And right now, the agency is responsible for it. What's the rationale behind that? Page 66, 66,
Senator McQueen.
27 is a section there.
Thank you, Mr. Chair. I believe that this section is compliance with federal law.
To move it down to
Senator
counties,
Gruenhagen.
to whoever wants to answer.
Senator Gruenhagen.
To move it down to counties from the agency is federal law?
Mr. Monahan.
Mr. Chair, Senator Gruenhagen, the department may be in a better position to answer this, but much of what's happening in these sections is clarifying the county's current responsibilities, as I understand it. Who responds to a report of maltreatment of a vulnerable adult depends on a number of factors, including where it occurs. In some cases, the counties are responsible for responding to investigate the maltreatment. But in any case, if a request is made for adult protective services, that is, under current law, a county responsibility. It's my understanding.
Is this,
Senator Gruenhagen.
oh, thank you, Mr. Chair. Yeah, because this is new language in here. So we must be replacing something or adding something.
Mr. Monahan.
Senator Gruenhagen, that is true. If you look at the repealer for this section, and maybe I forgot, or this article, maybe I forgot to mention that. That would be a mistake that you can note.
Don't worry, I make a lot of mistakes.
There should be, there it is. So on page 91, line 24,
Okay,
you'll see that it's repealing section 626.557, subdivision 10. If you were to look up that subdivision, it is a whole lot of very confusing language about the county's responsibilities to investigate and to provide adult protective services.
Senator Gruenhagen.
oh, thank you, Mr. Chair. Yeah, so this is trying to clarify that, in other words, correct?
Mr. Monahan.
Mr. Chair, Senator Gruenhagen, I believe that's correct. I believe the department would like to speak to this.
I think she wants to try to help me.
Ms. Grom. Yes, please come in. Welcome.
Mr. Chair, Senator Gruenhagen, so this language is new, and Mr. Monahan is correct in his description. There are various current roles delineated between the county and the state. The reason for this new language is because there was a federal law that was passed that required states to come into compliance with new definitions and new responsibilities around vulnerable adults and adult protective services. So this is language that we've worked on with the counties for a few years now and got to a place of agreement. The state does have to be in compliance by 2028. This is that provision I mentioned that we're ahead of the game, so we're hoping the legislature will allow us to get into compliance as soon as possible. But we haven't heard any concerns from the counties on this.
Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, my concern, of course, is that we have a little bit of a habit up here of trying to shift costs down to the counties. And does this do that?
Ms. Grom.
Mr. Chair, Senator Gruenhagen, not to my knowledge. I did double check with MAXA again. We've been very thorough in our discussions. We have a state county work group that we regularly participate in. And like I said, we've had a multitude of work groups on this topic over the years. I double checked again last week and this week, and that's not the way the counties are seeing this. They understand this is a compliance matter that we have to
Okay.
pass.
Senator Gruenhagen.
Oh, thank you, Ms. Chair. Yeah, I got several other questions, but I'll just ask one more, okay? On line 119.1, it prohibits residents, I assume nursing home, to get or have a guardian or conservator. Am I understanding that correctly? It's line 119.1.
Ms. Crum.
Mr. Chair, Senator Gruenhagen, I don't believe that's a DHS bill. I think that is another bill that was incorporated into this omnibus, so, but that is the way that that provision reads.
Well,
Senator Gruenhagen.
oh, thank you, Mr. Chair. Yeah, I have, I got an insurance agency, and I have a number of customers who've been in nursing homes, including my mother and my mother-in-law. And, they do get to a point where they need guardian or conservator, so I just don't understand why we'd want to prohibit that. I don't get it.
I believe it was a legislation that was outside of this, but Ms. Crum.
Mr. Chair, Senator Gruenhagen, yes, that's my understanding. I mean, Senator Gruenhagen, guardianship is one of the more restrictive things you can do to impinge on people's civil rights. So I think there are concerns in the community about overuse of guardianship and conservatorship. There's been bills over the year to modernize requirements, and my assumption is that that's where this language is coming from, but it's not
Yeah,
a DHS language.
I don't like the word prohibit, to tell you the truth, in relationship to residents. Anyway, just my thoughts. Thank you, Mr. Chair.
Senator Gruenhagen, thank you so much. Mr. Monahan, we can go to section Article 3. Is there any other, if there's no other questions from members? Okay, Mr. Monahan.
Mr. Chair, members, Article 3 is the substance use disorder treatment policy article. This committee heard Senate File 4726. It was a Senator Bolden bill. It's the DHS behavioral health article. But the entirety of that article is not within the jurisdiction of this committee, so what we did is we broke apart that article, and this bill is carrying only the substance use disorder treatment policy provisions from that bill. Senator Hoffman chose to include all of the provisions from that bill that fall within the jurisdiction of this committee, except the tobacco education provisions that were in that article. So there are no changes, and I'll just no.
Mr. Monahan, Article 4.
Mr. Chair, members, Article 4 is the policy bill brought forward by Direct Care and Treatment. Senator Hoffman chose to include the entirety of the first engrossment of Senate File 4399 without any modifications. I will mention, however, that portions of this bill will be in front of the Judiciary Committee on Friday, and if the Judiciary Committee were to amend this language, in all likelihood that it would be, this language would be amended to reflect what the Judiciary Committee had done.
Thank you, Mr. Monahan. Are there any questions from members? Seeing none. Mr. Monahan.
Mr. Chair, members, Article 5 is some long-term care policy provisions that fall under the jurisdiction of the Department of Health. So large portions of this article are from Senator Wickland's 4418, which was the Department of Health's policy bill related to regulating long-term care settings and providers. So the first group of sections are related to removing references to Chapter 144D, which was the old Housing with Services Establishment chapter that was replaced when assisted living licensure was enacted. And though we did the best we could to remove all of those, we didn't get them all. And so this group of sections is removing the stragglers. The next group of sections are the Department of Health's proposal related to the use of restraints in assisted living. Next group of sections, beginning with Section 4, is from Senator Mann's 3844. This is related to the use of automatic external defibrillators and associated training requirements in both nursing homes and assisted living. The next section, beginning with Section 5, is also from Senator Mann's 3844. This prohibits nursing homes and assisted living facilities from requiring residents to have a guardian or conservator as a condition of admission. The next group of sections, beginning with Section 7, are a MDH initiative related to policies surrounding change of ownership and clarifying the responsibilities and duties of the new owner related to the obligations that were incurred by the prior owners. Section 7 is a MDH policy clarification related to supplemental nursing service agencies. Sections 13, 14, 16, and 22 are the sort of second half of Senate File 4279. That's the proximity limitations for residential settings, small residential settings. These are the provisions that would relate to small assisted living facilities. Section 18 is also from Senator Mann's 3844. This modifies required disclosures by an assisted living facility to prospective residents. Section 19, also from Senate File 3844, modifies the requirements for documentation of requests and responses to requests for assistance from residents of assisted living facilities. Sections 20 and 24 are from Senator Abler's Senate File 4121. This modifies emergency training requirements for staff of assisted living facilities. The next group of sections, beginning with Section 30, are from the third engrossment of Senator Dibble's 2972. This is this year's language related to the regulation and notice requirements related to the purchase of nonprofit nursing homes and assisted living facilities by a for-profit entity. And Section 40 is from House File 3379 as amended, though I believe there are other bills carrying the same language. This is the language permitting certain long-term care facilities to serve intoxicating liquor without a license. And that is the conclusion of Article 5 and the bill.
Thank you so much, Mr. Monahan. Are there any questions from Senator Gruenhagen?
Yeah, I got a few questions on Article 5. You know, and Senator Wickland's here and she authored this bill. What are we doing different in terms of restraints in assisted living?
Senator
I
Wickland?
mean, what are the major changes?
Senator Wickland.
Senator Gruenhagen, I did not bring my file folder with my notes about this bill, but I see Ms. Timian is here and she could comment better because this was a Department of Health policy bill.
Thank you, Senator Wickland. Welcome. Please introduce yourself for the record and you may respond.
Mr. Chair, members of the committee, for the record, I'm Lisa Timian. I'm the Director of Government Relations for the Department of Health. So the restraints language is actually because when the assisted living licensure was enacted in 2019, the current statute is silent on restraints. So this just adds clarity, outlining both the reasons for when a restraint might be appropriate and when it would not be.
Senator Gruenhagen.
Oh, thank you, Mr. Chair. Thank you for responding to that. To me, couldn't that be a local control item, or are we telling the locals what they can and can't do?
Mr. Chair, Senator Gruenhagen, we'd say this is more of our regulatory role as the folks who actually regulate these facilities, that it's helpful for both the providers providing service, the families and the residents and their families, and then us as the regulators to ensure that there's processes in place.
Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, so do they have to report what they're doing when they put a restraint on to the state?
Ms. Timian.
Yeah. So, Mr. Chair, Senator Gruenhagen, this is really, it's about documentation, reporting, and staff training so that, again, they can understand the appropriate times to use this. And in the course of if there was either a complaint investigation about this or in the course of our surveys, which is just our standard inspection work, if something did not go according to what the statute prescribes, that could be cited.
Senator Gruenhagen.
Yeah, I'm just coming from my school board experience of 16 years. When the state starts telling us to micromanage how things, I mean, I'm not against some guidelines, but, local control, meaning people are right there dealing with the situation, and none of us want abuse, okay? We know that. But I've had workers in nursing homes that have gotten severely injured. They were customers of mine through my insurance agency, and they got kicked, they got knocked down. I mean, I'm just saying, I just have concerns about being over-prescriptive here, okay? And that you do need to allow a certain amount of local control on this. And maybe it does, but maybe I'll try to review it the next couple days. Okay, thank you. I do have another question.
Thank you, Ms. Timian. Senator Gruenhagen.
On SF 4279, proximity limitations on assisted living facilities. Well, we heard this one, and it seemed like to be a Brooklyn Park problem, okay, if I remember right. The way it was described, it sounds like this is going to be statewide. Is that correct?
Mr. Monahan, I believe so, but
Mr. Chair, Senator Gruenhagen, yes.
Senator Gruenhagen.
Yeah. I'm trying to think of one thing the government has done statewide that works very well. In other words, it's a one-size-fits-all, and I guess if they have a problem in a certain area, if we can help them out, that's fine. But I don't like the idea of mandating statewide, because you're going to run into conflicts in smaller communities or even in other areas of the metro area, in my opinion. Anyway, just my thoughts. The last question I actually have more, but I'll leave it at this. Senator Dibble's bill. Regulation and notice related to the purchase of nonprofit nursing homes and assisted living facilities by for nonprofits. So the way I read that, we're prohibiting for-profit entities from purchasing nursing homes or assisted living, or do I misunderstand?
I don't believe so, but Mr. Monahan, you can respond to that as well. Oh, Senator McQuaid.
Thank you, Mr. Chair. And Senator Gruenhagen, so that is a notification requirement.
Oh, okay. So we're still allowing it. It just would be a notification, correct?
Senator McQuaid.
Thank you, Mr. Chair. There's notification and a few other things put into place, but I can point you to a page in line if you give me a second here.
Okay. Well, I
Senator
just,
Gruenhagen.
oh, thank you, Mr. Chair. Yeah, I guess as a committee, I just don't like the government getting in the football huddle and calling the plays, okay? We need a referee, the government, but we don't need them in the huddle calling the plays. And sometimes we have a tendency up here in this, at the state to think we know better than everybody else, and we want to get in the middle of stuff that were well-intended, but the result is it actually restricts access in many cases. And so I don't know, that's just some of my initial thoughts. And I'll try to do some more research on that, okay?
Thank you, Senator Gruenhagen. Senator McQuaid.
Thank you, Mr. Chair and Senator Gruenhagen. So it would start on page 139, line 22, is where the stuff on regulation and notice requirements start. And I would just remind you, we heard pretty compelling testimony from a few advocacy groups that of the, I think, 25 substantiated cases of maltreatment, 23 of those happened in for-profit entities in Minnesota. And so I think we're seeing a pretty strong correlation between substantiated claims of maltreatment and the entity that is where these folks are living. And I think that knowing that information requires us to do something differently. And so this is a huddle we should get into, as you say.
Senator Gruenhagen.
Oh, thanks for that explanation, Senator McQuaid. You know, I know, you know, it just, how many of these incidences were actually investigated and were actually proved to be a situation like that? It just, you know, sometimes the people who put out data, you know, it's the old adage, figures don't lie, but liars figure. And I'm not saying it is a lie, but I'm just saying sometimes in government especially, and I could give you several examples, data is manipulated to favor a certain position. And I just think it needs to be vetted properly. And before we get into the huddle too much. Do any of us want abuse? No. Do I think the majority of owners or employees want abuse of residents? I don't think so. Are there incidences that happen? Yes. But we can never pass enough laws and regulations, in my opinion, to put a complete stop to everything. And when we do that, we actually wind up making things worse rather than better. Just my thoughts initially. Okay, thank you, Mr. Chair.
Senator McQuaid.
Thank you, Mr. Chair, and I don't want to belabor it. So Senator Gruenhagen, the claims that I'm talking about were substantiated maltreatment findings, so it wasn't just suspected. And I can share with you my Elder Voice Advocates report here.
Yeah, why don't you email that to me, okay?
Well, I can share the physical copy, or you can check your email, because I think they sent it out before the committee hearing where we heard the testimony.
Are there any other questions or comments from members? Senator Abler.
Well, thank you. Appreciate the discussion. One part that is actually moving along with a good amount of discussion behind the scenes is Senate File 4121, which is the fall training. You can pick up people if they fall down in an assisted living. And that's sections 20 and 24. So there'll be an amendment coming at some point along the line reflecting an agreement, or at least about between the advocates and the imperative. So
Awesome.
thanks.
Thank you so much, Senator Abler. Awesome. We concluded the walkthrough. No way. Yeah. You did. Yeah, so you want to...
He's way faster than you, Mr. Chair. We missed you.
Utke, is that true? The walkthrough's complete? I did my 3 bills in transportation, and you guys did it. Okay, that's good.
Well, Mr. Chair, you did 3 bills, we only did 1.
Utke's upset there's no spending. Did you hear that? The fiscal question comes to you, Senator.
Change it on Friday when we put amendments on.
So everybody's good about Friday? You know what we're doing on Friday? Did you guys have that conversation? No? No? Okay.
You can do that conversation.
We can do that now. So we're going to bring this up Friday, correct? And it sounds like robust discussion. So just for those folks, Friday, we'll take some written testimony if you want to. And then in lieu of person. In person, if you hear 2 minutes is what we're asking, because we want to keep things going on that. So, and then Senator Abler, you want to talk about what we did on the floor today with 4222 from Senator Wickland to us, which we're going to put, and then we're going to end up allowing folks to go.
Well, Mr. Chair, I was just thinking, maybe just in the spirit of like making everybody a little, it's going to be end of the week, 2 minutes for if you're not liking something, 3 minutes if you want to say nice things. How would that be? Never mind.
You got 3 laughs. That was pretty good.
That's pretty good, yeah.
Senator
Thanks.
McQuade chuckled on that one.
That's a good. Anyway, Mr. Chair, on Friday, in the Health Committee today, we moved Senate File 4222 to this committee.
Okay.
And that's going to be your vehicle to do some of the provider reforms in a very broad, inclusive manner. It's going to be very toothy or pithy or something. It's good. There's a lot of good reforms, a lot of good fraud improvement to do there, and then some due process matters. And so I think Sam has posted on Friday, if you read, for people to read, the A4 amendment is in this committee, maybe the other one. I said I was going to go work on 5 bills. I don't have the numbers, but the 5 bills to bring them all together, including Senator Mohammed's, yours, my bill with, and then there was the Hicks bill that we call it, and then I don't remember the other number, the one that's sitting in this committee still from Mr. Goodnow. So
correct.
And that crew. So that is my collage of that, and I tried to be very inclusive. I'm sure there's some parts that will be controversial to somebody, but then on top of that, Mr. Chair, there's I think Sam is either going to post it or will post 2 different documents, which are amendments to be done for the future when there's time to make them into amendments. But those reference even some of the federal standards for fraud. I think that you'll enjoy, and that's your bill, Mr. Hoffman, Senator Hoffman. But it's going to create quite a discussion, I think. And then there'll be other amendments brought forward as well that day.
Okay.
And then that's going to go to finance. So that's what I can tell you.
That way we keep Senator Wickland, and we're going to have that. It'll be a separate thingy, kind of what years ago was done. And so
it's going to be a coordinated, collaborative, and concentrated
comprehensive
effort, Mr. Chair.
Methodology. That gives us time, and thank you, Senator Wickland, for doing that and for being a partner in this. And so whatever happened, we're going to put a lot of stuff in there Friday. That's not the end product, members. Just remember that. The end product is then we're going to have some time to be able to go to finance and fix. So there's just, what we're trying to do is capsulate. Is that the word? Can I use that word, Glenn? Capsulate. So Senator Fata, did you have any comments?
Yeah, and I think one of the providers or RPMN brought this for you. There was a former legislation that is going to get amended on that was around reporting around ICS, but it's going to be more comprehensive now around long-term care services, identifying the gaps that are in place, not just states, but by counties, how many beds are in settings and things like that. So
is that going in our 4222 one, or is that going in our omnibus? Do you know?
Omnibus policy.
You're going to put that in the omnibus. You're going to bring that. Okay,
Correct,
thank you.
correct.
Okay,
So
good.
just-
And I know Senator Eckey's been working on some stuff too. Do you plan on okay, he thumbs up there. So I think we're set for Friday. So we'll start at 6 a.m. and
That's pretty funny. That's funny, Mr. Chair.
Senator Rasmussen, it's 11 a.m. Senator Rasmussen.
Thank you, Mr. Chair. Appreciate it. And I would just ask, as you know, I know there are a number of members, myself included, who have multiple committees meeting at the same time on Friday as well. So if we can just try to coordinate when votes are going to happen or things like that, that would be greatly appreciated. Thank you.
No, absolutely. And could just staff make sure Bryce and Emily and folks are making sure that's going back and forth and we're having the conversation. But because again, the real work, they're both real work, but the omnibus bill, we want to have that pretty locked solid. The 4222, it's a work in progress that Senator Wickland has, guaranteed that, we are going to be working together on that. And so it'll be a thing like Senator Abler, you and what's her name from Olmsted County.
Senator Cascaden.
Thank you.
So, Mr. Chair, that year, there was no bills moving. And there was a bill about diving depths for Rochester. We had to give them 1 foot of leeway or something. And so Senator Cascaden had that, which I called that a sloop. And so I put like 30 bills on mine that were all agreed upon. And so I called it a barge. At the end, Mr. Chair, the community called it the Ark because it rescued everything. So this may not be that big, but just happy days. And yeah, Senator Berglund and Representative Bradley were there at our.
They had to come.
Yeah,
I remember that.
Could you please put this in your bill? And there was a little bit of, that was kind of a fun moment, Mr. Chair. Thank you.
I love it. Any other comments other than our, Christy Grom says 6 a.m. sounds good, I bet. So, yeah, look, I got a thumbs up from the corner back there. 11 a.m., we're going to be here. I think we got some good work ahead of us. So, thank you. We are now adjourned.